it's our prime responsibility to give our women uninterrupted and excellent health because they are the main foundation of our family. Hi, my name is Dr. Ankesh Sahetya. I'm a gynecologist and sexologist from Mumbai. For the best content in women's healthcare and her gynecological health, kindly follow us on Kya Matlab. Thank you.
Many women during the age of their 40s, 50s, and even 60s who've previously given birth to one or more children via the normal vaginal delivery route. Some patients who have delivered in the hospital, some patients who have even delivered at home with a dye. Yes, a home delivery with a dye is very common in rural India and certain parts of even urban India. Because of excessive bearing down, because of excessive force by the presenting part, the baby, via the pelvic floor. Now let's get this straight. The pelvic floor is like a hammock with openings for the urinary area, for the vaginal area, and the rectum, the intestines, to pass out motion. So the pelvic floor is like a hammock with 3 openings for the urinary, vaginal, and the rectum area. Because of the presenting part, because of a large baby with a presenting head, presenting via the uterus through the cervix into the vagina, sometimes to expedite and to speed up normal delivery, the mother is made to bear down. Bearing down is a normal common thing which is made mandatory for every woman when she's pushing for normal delivery. Now, because of premature or uncoordinated or unsupervised bearing down without labor pains, at times the pelvic floor gets weak and the muscles get stretched permanently. The muscle, namely the levator ani, which is the part of the pelvic floor, levator ani is the part of the pelvic floor. When this muscle gets stretched at the hiatus level of the vagina, the organs like the rectum and the urinary area can prolapse through the vagina outwards. The most common prolapse is the uterine prolapse because of premature bearing down during labor. Without the need of bearing down, before the labor pains have actually come, if the mother is made to bear down, the uterus prolapses through the vaginal opening out of the external orifice. At times the bladder and the rectum also prolapse through this opening. And this is called as uterovaginal prolapse. The prolapse of the bladder is called as the cystocele and the prolapse of the rectum is called the rectocele. In the worst case scenario, we see a uterine prolapse with a bladder and a rectum prolapse, and this is a complete pelvic floor problem, pelvic floor defect. Depending on the patient's age, if she is old enough, her family is complete, she requires something called as a vaginal hysterectomy, which is an experative procedure done by a pelvic floor surgeon. Along with that, she requires repair of the uterus prolapse causing the cystocele and the rectocele. So the prolapse of the bladder and the prolapse of the rectum have to be corrected via the vaginal orifice to prevent any more descent of those organs. If the descent of the vagina and the rectum is not corrected, it could lead to problems in their organs like urinary and rectal incontinence and involuntary passage of urine because of incontinence and involuntary passage of stools. Hence, the surgery most likely required in these women is a vaginal hysterectomy, which is removal of the uterus with a pelvic floor repair to correct the prolapse of the rectum and the urinary bladder. If the patient is young, if in her 30s, if yet to complete her family, such a patient can also do well with a sling surgery in which the organs are reposited in their own position and there is no organ removal required. For more details, you can always contact me, but this knowledge is enough for now. Thank you.